What up? Cord here with 𝘼 𝘾𝙤𝙪𝙥𝙡, bringing you another video live and direct from Dallas, Texas. And today I'm going to talk to you about the 3 things I did to pass my mental health and psychiatric class here at WGU. Here, the nursing program here only required 3 months of that class, and I knocked it out with 2 weeks to spare. So I'm kind of just chilling until June 1st. When my new semester starts, I'll be in OB and Peds. But there's really 3 things that I did that helped me pass this class. I think if you focus on the wrong things, you can definitely be deterred and end up failing. But before I get into that, know that our 𝑘nomeatgeeks.com website is up and running. We did get the blog back up and running. 𝑘nomeatgeeks, you can find all the restaurants out here that we visit that have vegan, vegetarian, and plant-based options in the DFW area. And we're going to try to do that, at least 1 or 2 a month to show you the new places that we found. And again, you can find all the pictures, all the restaurants, and their addresses on our website, 𝑘nomeatgeeks.com. So definitely check that out. Be sure to like, share, subscribe with everyone that you know. Of course, if this video provides value for you, because that's what we're trying to provide at the end of the day. Let's go ahead and jump into it. So the first thing that I did to pass my mental health psychiatric class here at WGU is I made sure I followed the ATI mental health. Check it out. I think this is last year's version, but I don't really think it's, there's probably 1 or 2 things that are different from the most recent version. But as you can see, I have marks throughout this whole book. And I would suggest the very first unit, I think, is something like, it's like concepts or something like that, which is a lot of this psych stuff is common sense to me anyways. So yeah, the first one is Foundations for Mental Health Nursing. Be sure to read that. A lot of it seems kind of common sense, like I said, legal and ethical issues, effective communication, stress and defensive mechanisms. So these are things that you think that we already know, but they like to get really specific on the ATI proctored exam. And of course, you'll need to read through all of these. The book isn't long at all. So the book is only 310 pages, 30 chapters. If you read a chapter a day for a month, you'll make it through the whole book. So it's not that bad at all. I definitely recommend focusing on this, especially if your exam is proctored through ATI. The second thing I did that helped a lot was I made note cards. So for all the psychiatric drugs, there's note cards. So you have, fluoxetine, which is an SSRI, serotonin, brain fart, selective serotonin reuptake inhibitor. Gosh, I had a brain fart. Which is a antidepressant. So you see SSRI here. And then I had SSRI on one card here, and I had like all the adverse effects, all the things you should be, like the therapeutic levels. Let's see, let me kind of read it to you. It's been 2 weeks since I took this test, so I can't find the note card, but know that I did use the drugs out of the ATI book. So on each one of my note cards, for example, this is an atypical antidepressant. I would include the purpose, so what is it used for? Complications, so what are things that you need to be assessing for whenever on a patient that's taking these medications? What are some things that are common, and what are some things that are more adverse? So here you see with this one, adverse effects are headache, dry mouth, GI distress, and so anticholinergic effects. And a lot of these have a lot of overlap, so it's important to study on each one of these. Your administration, so when can you give this? Should you give it at night? Should you give it at the beginning of the day? How many times a day should you give it to the patient? When should you stop? When should you contact the physician? These are things that, if you're in psychiatric health, you should already know, a lot about medication administration and how to memorize your drugs. But yeah, note cards are huge. I had started making these, which was kind of focused on each one of the disorders. This is anxiety disorders. I had risk factors, expected findings, types of disorders. So anxiety has a couple different things. You have OCD, you have agoraphobia, which is fear of being outside in places, social anxiety, panic disorder. So you have to know all the little subcategories within. And again, expected findings, risk factors, and what you should do as a nurse. I started doing that. I didn't keep it up just because I feel like that was more memorizing. I needed to understand more than just memorizing, 1, 2, 3. And the last thing I did was I paid a ton of attention. The third thing I did to pass my mental health and psychiatric class was paid a lot of attention in my clinical rotations. So during the clinical rotations, I was on the PICU, which is the psychiatric ICU, intensive care unit. I did 3 days on the CD, which is chemical dependency, and I did 3 days on the adult psychiatric. So being there with all those patients is like, it's so real. Like, I'm getting goosebumps talking about it, but it's so real. And if you pay attention and actually take time to talk to some of these patients, you'll get a lot. It'll help you a lot on the test, because you'll remember, when you're talking to somebody that had paranoid schizophrenia, or talking to somebody that had anxiety or bipolar mania, and kind of see where they're coming from, what are their thought processes. That helped a ton. And when you do get into your psychiatric rotations, I'm gonna tell you, the first day I was nervous as hell, just because you hear psychiatric patients and you're thinking crazy, and it is a lot of crazy, but a lot of them, but what was real to me is that they actually have families, and these are people that actually have problems, and they don't want to be there, so why be an asshole to them, or why be scared of them, whenever they're the ones that are locked up in a way. But yeah, pay attention in your clinical rotation. So again, just to review, the 3 things that I did to pass my psych class, and I think that can help you in your nursing program, is to make note cards, make detailed note cards. Definitely study the ATI book, especially if your class is dependent on the ATI proctored exam. And lastly, pay attention during your clinical rotations. And that's it. I hope you guys enjoyed the video. Again, check out KnowMeGeeks.com. We have the blog running. You can check out 𝐂𝐻 our Instagram page. That's where we have all our food pictures. And like, share, subscribe. Like, share, subscribe, and we'll be talking to you soon. Peace.